Powell? Do we lose her?
Looks like you lost her connection there temporarily.
Okay, Commissioner Hoffman? Commissioner Powell?
I'm here. I had to switch computers. Something going on my other computer. I'm here. Oh, Pontiac.
Okay,
Here and from Pontiac, in Pontiac, sorry.
thank you. Yep, everyone needs to state their location. Commissioner Hoffman is not here yet. McGillivray? Commissioner McGillivray, are you there? I see your name. Jackson is absent with notice. Commissioner Nelson?
Here, Waterford Township.
Thank you. Commissioner Cavell? Gingell?
Here, Orion Township.
Okay. Kuhn?
Here from Troy.
Loops?
Here in Clausen.
Madam Chair, you have a quorum.
Thank you. I would also like to say happy birthday to Commissioner McGillivray, but I think we'll wait until he joins us. All right, please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. First item on our agenda is approval of the minutes from the last committee meetings on November 10th and December 1st. I have a motion by Commissioner Nelson and support from Commissioner Gingell. All in favor say aye.
Aye.
Opposed? That motion is carried. The next item is approval of the agenda. I would like to add to the agenda under the regular agenda an update on our vaccinations from our health department. Support by Commissioner Nelson, second by Commissioner Gingell.
I'm on a committee meeting actually.
All in favor say aye.
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 Opposed? That motion is carried. We're on to public comment. Is Commissioner Powell?
Oh, no, we had public comment. I thought we had got the communications. I have a question about communications. Never mind. Sorry.
Okay. First public comment. Public comment is open. But I know you're speaking, but I cannot hear you. Oh, no public comment. All right, public comment is closed. Thank you. We move on to communications. There are 3 items under communications to receive and file. The first is Friend of the Court Fiscal Year 2021 Access and Visitation Grant application. The second is from Animal Control Disposition Report for November 2020. And the last is from Health and Human Services Fiscal Year 21 Medical Marijuana Operation and Oversight Grants application. I need a motion by Commissioner Gingell, support from Commissioner, who would like to support that? Commissioner Nelson. Thank you. Commissioner Powell? And followed by Commissioner Kuhn. Commissioner Powell, do you have a question on
Communications? Yes. I just wanted to get a clarification on that marijuana number C. I know you had signed off on it Chair, and I just wanted to get a little background just to know what this was and what are we doing with this. I did read through it, but I just wanted a brief synopsis from the chair if possible.
Well, Health Department was wise in including Ms. Cassis to answer any questions.
Oh, there go Leanne. I didn't see Leanne. Hey, yes, can you just give us a little description on number C, please? I was just wondering what that was. That's all.
Yeah. And actually, I'm going to turn it over to Hannah Cassisi. She's one of our health ed supervisors. She oversees this program, and she can give you all the information you need and answer your questions. So Hannah, you want to go ahead and get started?
Oh, yeah, sure. So this is a medical marijuana operation and oversight grant, which is funded by LARA. So we received these funds back in fiscal year 19, and we are reapplying again for fiscal year 21. So this is specific to education, outreach, and awareness on medical marijuana. It was a former grant that was awarded to law enforcement agencies, and in fiscal year 19, it then shifted funds over to local health departments. Is there anything more specific that you need me to get into at this time?
No, I just had a question for Leanne. So Leanne, is this incorporation of that pamphlet, remember we was working on, and then we kind of paused all of that information? Is this what, okay, got it. Okay. So Chris,
expand on those efforts. We will expand on those efforts and continue to create communication and educational, similar to the pamphlet, and additional ideas with this grant money. Yes.
well, a lot of the stuff that y'all plan to roll out, will any of it come before the commissioners so we can see some of the stuff, or you'll just share that once you all produce those pamphlets and things? Because I know in the first round before, it was some concerns that was stressed with me and me and Commissioner Nelson in regards to that pamphlet. And I just wanted to make sure if we can have some, or just to make sure we just get to look at it as well. After or before, it doesn't matter. I know y'all got to keep things rolling, but yeah, I just know we had some concerns about the other one.
As we're designing things, we can look for input and maybe some feedback from a couple commissioners if you're interested in being part of that. And we can work that into our timelines as we're creating new documents and educational materials. So I'll have Hannah work on that, and we'll make sure we provide you some opportunities for review.
Yep, and just to let Hannah know why with me, because you all know I think the most that eventually can go up in the whole county. So I just wanted to be able to aware of the information that we're putting out. So thank you.
Thank you.
Absolutely.
Commissioner Kuhn, did you have a question?
Yeah, I had a couple different questions, Madam Chair. Thank you. And since we started out with the grant application for marijuana, I did see in there that you had this 2019 grant, and I was just wondering if we can, I'm new on this committee with regard to healthcare, and I was wondering if we could somehow get some background on how the 2019 grant is being used or has been used. And I see in the current grant, there's requests for strategies and surveys and website analytics. I was wondering if any of that had been utilized in the prior year to try and identify targeted populations.
Yeah, so the fiscal year 19 grant, a lot of the topics that are being addressed in the fiscal year 21 grant are just building upon what we worked on in fiscal year 19. And so in the fiscal year 19, we really worked closely with regional partners to identify those specific topic areas that were identified, like impaired driving, pregnancy and breastfeeding, safe storage, things like that. So that's really where our direction is going to continue to go. In fiscal year 21, our main focus is to get the survey out to help us determine the best ways that we can support and improve that awareness and assess needs related to the medical marijuana industry and the patients that are using medical marijuana, so that we can then develop more targeted educational materials and outreach activities. Does that answer your question?
Yeah, well, thank you. And maybe I can spend more time with you and get more information outside of a committee meeting. But
Yeah.
I did have a couple other questions. On the section A, which is the access and visitation friend of the court, is this the same as our agenda item? I mean, this is the grant application, and there's another grant acceptance on our agenda. I was just wondering if they're the same issues or same things. Is anybody from Friend of the Court here? Okay. Well, I'll save my questions on the Friend of the Court access until we get to that agenda item. And the other question I had was with regard to the animal shelter. Is there anyone here for the animal shelter? But seeing no one thing I'd like to see, if we can, is the COVID impacts that have had on these different departments and services. And so that was my question with regard to the animal shelter, and hopefully we'll be able to get that. Thank you.
Thank you. Is there staff that would be able to refer Commissioner Kuhn's questions for answers or follow-up?
Sure, I will make contact with Animal Shelter and connect Commissioner Kuhn.
Thank you. Commissioner Nelson?
Thank you, Madam Chair. Just a few questions in regards to the medical marijuana oversight grant. I am familiar that it is an annual grant. Can we get some additional insight on how many years has Oakland County been a part of this specific grant?
So I know the Health Division, this is our second year, right, Hannah? So 2019 and 2021. We could probably get additional information. We could follow up maybe with the Sheriff's Department and see, because prior to it, I think the Sheriff's Department received that. I don't want to put them on the spot here. They may have the information, but maybe we can follow up to get that information for you.
Sure. And additionally, when is the open application date?
Oh, this is Hannah. Laura, you want me to go ahead, Leanne?
No, go ahead, yes.
Yeah, so Laura opens applications this year in mid-December, and then the application is due at the end of December. So actually it was due January 1st. So it's a very expedited timeline for this grant. Definitely different than the other grants that we receive.
Sure. I know how busy, especially right now, the health department is, and I do take that into consideration. The one thing I would like to request is, just given that it is an annual grant, we do know that this is coming up every year, mid-December. And I'd like to hopefully, as we go through this next year, that we do have the opportunity to have it go before committee prior to submitting the application. The other thing I'd like to request, Madam Chair, is given that the stipulations within this grant has a requirement of quarterly financial status reports, I'd like to request that the Health Division come back to the committee to just kind of give us an update on, you know, where we are at in the process and the progress that we are making within this grant. I think that what the dates are, April 1st, July 1st, and September 15th at minimum. I'd really like to have this come back to committee to just kind of get an update on where we are.
Thank you. All good ideas. Are there any other questions on communications? Commissioner Kuhn? You're on mute.
Yes, I know. Thank you, Madam Chair. I just had a brief follow-up from Commissioner Nelson's questions. It seems like on several of these grants, they have a deadline, but we aren't actually meeting the deadline. What kind of flexibility do we have in filing the grant application? Can anyone answer that?
for this grant, it had to be completed by, January 1st. There was no extension. And so, with that short timeline, that's kind of why we had to ask for the exception. But Commissioner Nelson, we kind of had the same conversation, even though the funding is not guaranteed from year to year, right? Come 1st of November, even earlier than that, even start thinking about maybe what the next steps are so that if we do get the funding, how can we get this in front of the committee so that you all can review it prior to us submitting the grant? So we understand the frustration too. It's, during this, the holiday season. And so we're going to try to get in front of it as well. And if we get the funding or the application comes out, we're really going to try to, get in front of you and explain what we're looking to do with the funding moving forward if we get it. So there's not a lot of extension on this one, Commissioner Kuhn. Sometimes they'll give you some wiggle room. On this one, we're not provided any additional time to submit it.
Okay, and I appreciate that. It's just that the date that David Woodward signed it was January 5th, and I just thought that indicated that maybe you had gotten some extension on it. Thank you.
Thank you. Any other questions, comments on communications? All in favor of receiving and filing, say aye.
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 Opposed? All right, we're going to receive and file that. I'd like to note that 2 commissioners joined our meeting, so I believe they need to announce where they're from. Is that right, Pam?
That is correct. Thank you.
Gary McGilvery, Madison Heights, and thank you for the birthday wishes.
Oh, happy birthday.
Happy birthday.
I heard them, but I just couldn't get on. The meeting kept throwing me off, so I finally figured it out.
Thank you. Glad you're here. Commissioner
And
Cavell.
Commissioner- Sorry, go ahead.
And Chair, I'm supposed to do me now.
Yes.
Commissioner Charlie Cavell from Ferndale, and again, apologies for being late. I was I've given out my county cell phone number to voters, and they're calling it about COVID vaccine. So very excited to talk to you, Ms. Stafford, and the health folks. But yep, sorry for being late. Was talking to voters.
And where are you, did you mention where you're calling from? Okay. All right. Thank you. Then we're good. We're moving on to our regular agenda item. And Commissioner Cavell, you'll be happy to know we're going to have an update on vaccinations by Leanne Stafford. So I need a motion. Motion by Commissioner Nelson. Oh, I don't need a motion. For
Yeah,
that.
we don't have anything to receive and file, so we're good.
Okay. Thank you. All right, Leanne.
Good morning and Happy New Year for everyone that I haven't had an opportunity to chat with or had emails with. A little bit about our vaccine, what we have been doing really since we received our initial vaccine and, kind of what we're looking at moving forward. So as you probably have heard, we have really received minimal amount of vaccine. And actually through today, because we did receive a very small shipment of 975 doses today, we have received 6,800 doses total in the past, really 4 weeks is really what it boils down to. And that's about 1,950 doses per week is what we receive. So it's trickling in when you look at the size of the population. When we look at the phases, which I'm sure you've heard the governor talk about. So for the Health Division, our initial priority and focus was on phase 1A, and the Health Division really was focused on EMS providers. And so we worked with our Medical Control Authority in Oakland County to get the word out. We focused on EMS the first, the week before Christmas, the holiday break, vaccinating our EMS workers. We had about 850 EMS workers in Oakland County that signed up and registered and came through our drive-thrus. So what we have done here at Oakland County at this point is converted our testing sites to also use them for vaccine drive-thrus, for vaccine distribution. It has worked very well because it allows us to not be outside, right? Because it's Michigan and it's cold and it's snowy, and it gives us an opportunity, for some coverage inside the fire stations. It's a really great flow. Fire stations have been working amazing. I actually worked and assisted at the Rochester one on Saturday, and the processes, they've really done a great job. My staff have creating a very easy process. So after we did the EMS providers, our next focus was long-term care facilities. So what the federal government did is they worked with CVS and Walgreens to set up a program, and it was a contract working directly with the long-term cares throughout the country. So what happened was Walgreens and CVS got a contract, and they would go in and do all the workers and the residents in these facilities. What was sort of unique in Oakland County is we had close to 80 facilities that were not matched with CVS and Walgreens. We really have not had that. There's not really that situation anywhere else in the state. So we have really been focusing on the EMS providers, trying to get into some of these long-term care centers, and also trying to focus on healthcare providers. So any healthcare provider that is affiliated with a hospital, hospitals received vaccine directly from the state, and they vaccinated their own workers. That included anybody that was direct hospital staff or affiliated with the hospital. So they handled and vaccinated that group of individuals. But those that aren't affiliated with any of the hospital systems actually fell on our shoulders as well. So as you can imagine, when we talk about dentists, physical therapists, optometrists, anyone that it's basically a medical provider touches a medical provider, security officer that maybe works in a private practice. There's really tens of thousands of these individuals that are in Oakland County. And really with only 6,800, we haven't really scratched the surface of those yet. So we were moving along really good, starting to vaccinate and get these groups into our long-term cares. And then last week, as you all probably heard, the governor announced that we were moving to the 1B phase, which included 65 and over residents, teachers, daycare workers, law enforcement, those fire departments that did not meet the 1A priority, and all other, essential workers, which is a there's quite a few people in Oakland County. Just in Oakland County alone, just an example of 65 and over, we have over 217,000 residents that are over the age of 65. So that is, a heavy lift for everyone, right? Not just the health division, but, hospitals. There are approximately 1,000 providers through the state of Michigan that have started registering through Michigan, the state of Michigan, to be able to provide vaccine once there is a steady supply and they are able to, provide more vaccine. So in Oakland County at this point, all of the vaccine that we have received to date, and actually through the 1st of February that we are set to receive through the state, is actually, they have appointments allocated for them. So we are hoping that we receive more vaccine than we're expecting. At this point, we have received the first 3 weeks what we asked for, which we were told would probably be around 2,000 doses, which was 1,950. This past week, we asked for 5,000 and we received 1,950. So, we're really trying to ramp up. I can tell you, as someone that did H1N1 and was very involved in many of, the people in the health division, we are prepared for this. We have the staffing, we have the locations. We're working with, Novi Showplace to try to get, a mass vaccination and other locations. We're ready to give the vaccine when we have it in our hopper and, we're aware that it's coming. So we could do upwards of, 12,000 people a week and even more as we ramp up. So I know you have gotten a lot of calls from your constituents and your voters asking about this. When we launched our online site last week, and it was really by word of mouth only. We did not send out any notification. We didn't do any press, anything at all. They brought down the system in less than 12 hours. We had 28,000 callers that hit our phone lines in like less than an hour. And we understand people want the vaccine, and that is news to our ears. And we are looking forward to, providing an opportunity for anyone that wants that vaccine once, we receive that shipment in-house. So we are going to make some changes, just so you know. We're working on possibly a form that we can do kind of like a queue for people, so that if they're interested in the vaccine, they would be able to register for this form and be able to get, notification when a vaccine is available. Currently on our website, there is an opportunity for people to register their phone number or their email address, so that when changes to the website, for example, we're adding vaccine, we've received additional vaccine, it is available, and we've added that to the website, they can be notified. So we are looking for opportunities, right, to make things more efficient. In the registration process, we understand it has been extremely frustrating for our residents to try to find an opportunity to register for an appointment. I've received quite a few emails myself from people. My email address was out on the state website, so I've received quite a few and and have answered those residents that have asked, how do I register that? We just need people to be patient at this time, that we are ready to give the vaccine when we receive it, and that we will provide communication when we have more information that we know the vaccine's coming.
Thank you. I understand that we'll have a new website and system in place that people without access to the internet, community, and a rotary dial phone will be able to schedule a vaccination.
That's correct. We're implementing a new call system today, which is exciting for us too. It'll allow us to expand our efforts for quite a few people in the health division can answer the calls as it starts to build up even more. But yes, so they'll either be able to do an online registration for a vaccine or be able to call. That's correct.
Thank you. Commissioner McGilvery.
Thank you, Madam Chairwoman. Leanne, I got a phone call from Madison Heights City Manager and Police Chief saying that they were unable to get 50 vaccinations for their police officers. They've made several attempts and have not been able to do that. Can you do me a favor and give me a call so we can talk about that and try to get that corrected?
Yes, I will reach out to you and we can kind of walk through the process. Yes, definitely.
Okay, thanks.
Commissioner Nelson.
Thank you, Madam Chair. Leanne, just for some clarification, I know that you had mentioned that there are some additional changes to the website in regards to being able to register. When we talk about being able to register, is this like a wait list?
That's the plan. Yes. It's kind of like a queue, right? Yeah. That would be the idea that if somebody's interested in vaccine, they can get in the queue. And then basically when we get minimal amounts, see, our biggest problem, let's say we get 1,000 extra vaccines. If we open the website and we say, we've got 1,000 vaccines, we have 100,000 people hitting the website at one time trying to get those appointments. So this allows us an opportunity to maybe prioritize those that are in the 1A and 1B group and push out communication directly to those individuals to say, okay, this is an opportunity, you can call us. Maybe it's a link to that online registration that gives them appointment directly. And then it's a little bit more controlled until we get a large amount of vaccine where it's easier for people to go in and register. It kind of gets them in, like you said, kind of like in line to, notify us that they are interested in receiving the vaccine.
Excellent. Thank you.
Thank you. Commissioner McGilvery.
Thank you again, Madam Chairman. I heard by way of the news that Beaumont Hospital is offering it to anyone over 65 at this point. And I also saw that they got a large amount of vaccines. Why do they get so much more than a total county? I don't understand.
So initially, I think they were awarded a significant amount because the focus was really on their healthcare providers, right? Those in the hospital. Beaumont receives for Tri-County, even though it looks like it's all coming to Oakland, it's actually for all of their hospital systems. But that is a great question. We've been asking the same thing. We're all partners in this, and that's really how we have to look at it, right? No matter who Beaumont does, whoever Oakland County Health Division does, at some point, pharmacies, we're getting vaccine into individuals. But we have asked the same thing. And I think what the plan is state of Michigan is only getting 60,000 vaccines across the state right now. And so the demand is, way above the supply, that's for sure. And so, we're starting to see that health divisions are getting a little bit more than they were over the past few weeks. The state has kind of changed, their plan and how they're providing the vaccine. We're hoping that, we're starting to receive similar doses that like Beaumont is. But again, I think really if we're referencing Beaumont, they do have multiple, they use their whole hospital system, which is I think 3 counties at least, if not more. And so what they're getting is really to supply all of their counties. And yes, they are moving to the 65 and over, and I think some teachers and essential workers. We did have a conversation with them this week.
Okay, thank you.
Commissioner Nelson?
Thank you, Madam Chair. Just to follow up, Leanne, do we know when the registration on the website is going to be available?
We're working on it now. Actually, they're trying to finish it up as I'm on this call so that we can, get it to the executive team and we can get it out as soon as possible. So,
You think by the end of the week into next week?
That's the plan. Yeah. I mean, hopefully days if we can. Yeah.
Excellent. Thank you so much.
Thank you. Commissioner Cavell?
Thank you, Chair. Hi, Leanne. First, thank you for answering the couple emails I sent you last night, because now thinking about all these people on this Zoom meeting, and then let alone that your email was published to everyone that cares about COVID in Michigan, like, rock on, hats off to you, I hope you find some sleep sometime soon. But first, I would just want to give a shout out to Nurse Lakeisha and Nurse Shauna, who are 2 nurses on call that constituents and myself have reached out to in the past week, or, doing the 800 number, and they were really helpful. So I don't know if there's multiple people named that or whatever, but they rock. So if I could ask you a couple questions, and happy to go offline to not take too much of the group's time. But one question I have that's outstanding is just to make sure I get the numbers right. And then a question about primary care. So you said Michigan has 60,000 doses. Is that for the week? Is that for the month? Is that thus far? What is that delineation?
That's per week. They receive about 60,000 per week.
Okay, and then we're supposed to get about 1950, right?
We have been allocated 1950 per week up to this point, yes.
And we're asking for 5,000 a week.
We asked for 5,000 last week. We're going to up that even number next week. So we understand that they're under limited constraints,
Sure.
right? They're trying to share across the state, all health departments, all health systems. And so, we were trying to be reasonable, right? Asking for the ask from them is ask to get rid of with 90% of it in 7 days. That is their ask. So we know we can do 12,000, but we know they're not going to be able to give us 12,000 at this point. So we're trying to be reasonable and really ask for what, without all of our staff being involved all the time, which we will ramp up to at some point, how do we operate 7 days a week and offer it in different parts of the county so everyone has an opportunity to receive it and they don't have to drive to Holly or South Lyon, so we try to do around the county. And really, again, our goal is to be at 0 when we receive the next shipment of vaccine. So that's really our goal every single week, that there's nothing sitting in the freezer when we get the next shipment.
Okay. And then you said the appointments are booked until February 1st, right?
Right now,
Thank you.
The allocation that we have received or that we plan to receive in the future the appointments have been allocated at this time. Yes. If we get additional vaccine over what we had planned, then we will be able to offer additional appointments.
Okay, and then the registration form that you're making to make that queue, so that like I'm 30, so if I register, I could become, person number 1.3 million or whatever. Is that how that queue would work?
Yeah. And then
Okay.
we'll look at it, right? So there's really been a transition too, that they want us to take 75% of the allocation that we receive and focus on the 65 and over population. So that will give us an opportunity to really look at who's in the queue, right? Those kind of questions will be asked, what's your age, what age group do you fall within? And then also what is your essential service, right? So
Gotcha.
that we can start to allocate those across the board based on those percentages provided by the state.
So it's like a bit of a matrix, X, Y, and okay. What will that website be? So when I'm talking to folks, I can say, go to this website to
Yes,
sign
it's
up.
actually going to be on our vaccine website. So if you go to oakgov.com and then you follow the COVID sign and then the vaccine sign, right? So we have little buttons up there right as soon as you open it. Then we really want to push people to our vaccine site. There's a lot of questions about supply and FAQs, and so the link will be there. That's the plan, is the link will be there.
So I've heard from different folks that there's the oakgov.com thing, but there's also oaklandcountyvaccine.com, which
It's the same. They're connected. So actually, when someone goes to oakgov.com, selects COVID, and then selects vaccine, it takes you to the Oakland County vaccine site. So,
okay, cool. And then just two last clarifying questions about that, and then a question about primary care. You said there are 100,000 people at a time on this website?
I just used that as an example, right? So I know, like I said, at one point when we opened the main website, we had 11,000 people hit the same link at the same time. And so those are the numbers, that's just one number that we're kind of dealing with. We had a lot of people, there's interest in demand, and we love that if we just had the supply. So,
Sure.
yeah.
It just seems like a good thing to recognize that, 11,000 people are going to a website all at once. So if there is a lag in the website, perhaps that's just what's going to happen, right? Or you said there were 28,000 calls in a day or something like that. Well,
Like within an hour hitting our system one day. So it was
then a 5-minute wait is okay.
yeah.
Okay,
Some of those
understood.
individuals most of those individuals got a busy signal because our infrastructure just couldn't handle it. So that's why IT and if anybody on here is on IT, or if you all get an opportunity to thank them, I mean, they have just been amazing. They stood up this call center in less than a week. We have taken down the whole phone system multiple times because we received so many calls. So IT's done a great job. So, yep.
Okay. And then my last question, and again, thank you everyone for indulging me. So one person I was just talking to was talking about primary care. So if you live in a nursing home with parents who have a deal with the Moderna vaccine or Walgreens or whatever, something other than what Oakland County is doing, what is it recommended they do? Because I've been hearing that there has been a lag, right? Oakland County's getting the Pfizer and we're rolling it out and y'all are doing a great job. But then there are private institutions or Beaumont that are kind of also sending signals that they can do things. But if you're not in line, then which should people go to first?
So if it's a long-term care center, right? So if they're in an independent living or like a skilled nursing care, there are contracts with CVS and Walgreens that they will get to them, right? So that's coming to they've been allocated or will be allocated the vaccine directly, the Moderna vaccine. If they're in an independent living, Oakland County Health Division we're working through those facilities. If it's, there might be some independent livings that we may not be associated with or may not be on their list. If they're associated with Beaumont or Henry Ford or another facility, then they should reach out to that, or they actually register through their electronic medical record is how Beaumont does it. And so if they reach out to these facilities and ask if they have vaccine available, I know the hospitals are looking to release to that 65 and over, in that population. So I think it's kind of looking at who has the vaccine, if they can get in at Beaumont, right? Or another healthcare provider, that's probably should be their goal of getting in and trying to get the vaccine through them. It really just depends on when the supply opens up where, additional vaccine is available at this time.
Okay. Thank you.
Commissioner Nelson?
Thank you, Madam Chair. I really appreciate you taking the time today, Leanne, to update us. I mean, as you know, this is such an important, critical, hot topic, and there's just so many people asking a lot of the same questions, but just it's difficult sometimes when things are changing so rapidly to keep messaging consistent. Is there any way that we could get a summary of what was shared today so we can make sure that we are communicating a consistent message to our residents and constituents who are contacting us, and also to being able to share this information on social media to help eliminate some of those calls maybe that are going out to the nurse on call, in addition to commissioners?
Okay. Yeah, we can work on a summary that we have probably pieces of it everywhere. We just need to pull it together. So yeah, I'll work with our team to put something together.
Excellent. Thank you so much.
Thank you. Are there any other questions regarding vaccinations? All right, we are moving on to the next item on our agenda, which involves Leanne also, from our Health and Human Services Department, fiscal year 2021, Michigan Department of Environment, Great Lakes and Energy Reimbursement Agreement Grant Acceptance. So I need a motion. I have a motion by Commissioner McGilvery and support from Commissioner Nelson. Leanne, welcome.
Thank you. So this grant from EGLE is a reimbursement grant for a few of our environmental health programs. So our type 2 water supply, so that is any business or facility that has more than 25 individuals on a daily basis through their facility. They're required to do water sampling. So it's for us to work through our requirements for them, contamination monitoring at locations throughout the county where, there could be contaminations for us to do water sampling. This involves our public swimming pools, our campgrounds. And so the amount, we did get an increase a little bit this year. And a lot of time that has to do with increase in supplies, right? Either number of wells or number of contamination sites, new swimming pools that maybe come on board. So the reimbursement grant is for $285,623, which is an increase of $9,051. There are no personnel changes on here, and there is no match for this grant.
Thank you. Are there any questions regarding this item? Commissioner Kuhn?
Yeah, thank you very much, Madam Chair. Actually, I had a bunch of questions. I don't want to take up too much time, but if you could, if someone could send us the contact people for the health department so we can talk to them directly. As a new member of this committee, I don't know much about these different programs, and I think it would be helpful to get that information. Thank you.
Thank you. Any other questions? Roll call, please.
On item number, or new 2, Commissioners Powell,
Pass.
Hoffman,
Yes.
Commissioner Hoffman, can you just announce where you're calling from? Location?
Beautiful Holly, Michigan.
Thank you. Gilray,
Yes.
Nelson,
Yes.
Cavell,
Yes.
Gingell,
Yes.
Kuhn,
Yes.
Powell,
Yes.
Loops.
Yes.
Madam Chair, you have 8 yeas and 0 nays.
All right, motion carries. Thank you. Our next item is also from the Health and Human Services Division, the interlocal agreement with Oakland Intermediate School District for public health nurse services. Leanne, I have a motion by Commissioner Nelson, support from Commissioner Gingell. Thank you. Leanne, we're ready for you again. This is an item I'm excited about.
Yeah. So this is actually a interlocal agreement that we have with Oakland Schools. We actually split the salary of one public health nurse. This is actually, I think, our second year that we've had this agreement. And this agreement goes from September 1st, 2020 through August 31st, 2021. And so what this nurse does, and this is over and above the nursing program that we put together for the COVID program. This nurse, prior to COVID, really worked with Oakland Schools to develop school-related policies and documents so they were consistent across the county. Districts would have different wellness plans and things in place. And so what this nurse does is she works with these individual districts. If there is a public health nurse or a nurse, school nurse at these individual districts, she works directly with them to really create some consistency across the districts in Oakland County. They have a networking group where they meet on a monthly basis to kind of talk about ideas and best practices. And actually, I truly believe through our COVID program and through our nurse that's been working on this, many school districts have hired school nurses into their district, which is a great benefit. So I think with this and our COVID nurse program that we've been running since really the early part of the pandemic, this is a great program, and it's really a half a salary is really what it boils down to. So it actually is a great opportunity for everyone.
Thank you. Any comments or questions regarding this? Commissioner Kuhn?
Yeah, thank you, Madam Chair. I just had a question on page 103 of our packet. It talks about a gap between public health and school-based health services. Do you know what that's referring to?
I think what happens is, our public health work that we do until we, bring this nurse as we kind of combine the two together. School has its own language, public health has its own language. So there's a gap there where sometimes maybe we're saying the same things, maybe we're not, but it's a way to pull those two programs together. And so what they look at is what gaps that maybe public health nurses can provide input on or direction on that exists, and she works to keep those gaps from happening. And so what can they do to make the health of the students and better, and using some public health best practices to do that in the district in the classrooms.
Thank you very much.
Thank you. Any other questions or comments? Roll call, please.
Item 3, Commissioners Hoffman,
Yes.
McGillivray,
Yes.
Nelson,
Yes.
Cavell,
Yes.
Angel,
Yes.
Kuhn,
Yes.
Powell,
Yes.
Lubes.
Yes.
I'm sure you have 8 yeas, 0 nays.
Our motion is carried. Thank you. Our last item from the Health Department is fiscal year 2021 subrecipient agreement between Oakland County and Oakland Livingston Human Service Agency for WIC services. So I have a motion from Commissioner Nelson, support from Commissioner McGillivray. Thank you. Leanne?
Yeah, so this funding is actually received through the Oakland County Health Division, and then OSA is a sub-recipient for the money, and this is for WIC services. The funding is really based on caseload, and so what it was, this was through a bid process in 2018. OSA won the bid. I mean, they've been a subcontractor with this our grant for many years. So they are actually, they operate 5 different locations throughout the county. And so they receive the total budget that they get is $567,405, which is a small increase. And they provide, like I said, both WIC services and also WIC breastfeeding services, which is a small portion of the grant to help people identify when they're having problems breastfeeding and providing support for that.
Thank you. Any comments or questions on this item? Commissioner Kuhn?
Yes, thank you, Madam Chair. Again, I apologize as a new member here. Can you just give us a brief synopsis of what the WIC services are? And it indicates it has to do with resident services and a caseload of 3,215. How are those? Can you just give us a brief summary on that?
So WIC is, education and a food supplement to those that qualify. And so it can be any pregnant, postpartum, or breastfeeding women, any child from birth to 5 years old. And so they come in, right now we're doing everything virtual, but they get an assessment and then they are awarded or provided money or funding to receive food and assistance. And through that, we also do educational messages. They get supplemental food benefits. And so there's also a peer breastfeeding service. So that's part of that additional grant. So when a mom is, breastfeeding and maybe she is, struggling, we have an opportunity for her to work directly with someone. We can do a house visit to assist her, to really try to be successful in breastfeeding. If you don't have anyone that's been able to teach you how to do that, or, maybe someone prior to you in your family did not, this is just an opportunity for us to really reach out and be successful in breastfeeding. So the program's been around for a very long time. We run the program out of 3 offices ourselves here at the Health Division. So we have a Pontiac location, a Southfield location, and actually we're in Walled Lake as well. And so individuals sign up for this, or we may get a referral from a healthcare provider or one of the service agencies, and then we're able to enroll them and provide these services.
Thank you very much. Appreciate it.
Thank you. Any other questions? Roll call, please.
Commissioners McGillivray,
Yes.
Nelson,
Yes.
Cavell,
Yes.
Gingell,
Yes.
Kuhn,
Here, yes.
Powell,
Yes.
Hoffman,
Yes.
Lubes.
Yes.
I'm sure you have 8 yeas, 0 nays.
Thank you. Thank you, Leanne, for all of the information.
Thank you so much.
All right. Our next item is from the Sheriff's Department, the contract amendment number 2 for law enforcement services in the Chartered Township of Oxford, 2019-2021. Have a motion from Commissioner Gingell, support from Commissioner Nelson.
Hoffman.
And Hoffman, thank you. I know it's awkward with using the phone and the Zoom system. So, we have our Undersheriff Mike McCabe and Gaia here.
Good morning, Commissioner, Chair, and Commissioners. This is to add a deputy to no-fill to our Oxford Township substation. Oxford Township late last year passed a slight millage increase to the millage they already have in place, which is allowing them to add another deputy. This deputy will be basically working the 7 p.m. to 3 a.m. shift, which is the busiest time for calls for service. So we're pleased to ask you today to add this deputy to that contract, which will bring us to a total of 20 personnel at that substation.
Thank you. Any questions regarding this item? Nope, seeing none, I'll call for a roll call.
Commissioners Nelson,
Yes.
Cavell,
Yes.
Gingell,
Yes.
Kuhn,
Yes.
Powell,
Yes.
Hoffman,
Yes.
McGillivray,
Yes.
Lubes.
Yes,
I'm sure you have 8 yeas, 0 nays.
motion carries. Thank you.
Thank you.
Our next item also from the Sheriff's Office, acceptance of donation for K9 dogs. So I have a motion from Commissioner Nelson, support from Commissioner McGilvery.
Madam Chair and Commissioners, this is a request for acceptance of a donation of a canine to our canine unit. Timing on this is very good for us because we're in the process of retiring one of the 12 canines that we have. This will get us back up to 12 canines, which consists of 4 bomb dogs, 7 narcotics and utility dogs, which are tracking dogs, 1 dog that's assigned to our fire investigation unit that does accelerants. We have a total of 9 handlers with 12 dogs. So we have 3 handlers that actually have 2 dogs, but they're the 2 dogs with each handler are, one's narcotics utility, the other is a bomb and explosive. So it comes real handy. They drive the Tahoes, which allows us to have 2 dogs in the vehicle. So it's efficient use of our resources. At one time, we did have 15 dogs and 15 handlers. We've combined that down into a total of 9 handlers now with 12. Eventually, we hope to get back up to 15, but due to some staffing shortages, et cetera, we're going to wait till later to make the request to fill those. But we're asking you to accept this donation today. And as you all know, our canine unit is one of the largest in the state of Michigan. We help service all the local police agencies, including our contracted communities. So somebody's on call 7 days a week, 24 hours a day. If this group, if they're working, they'll respond immediately. If they're not working, somebody gets called out to assist either our agency or any other agency within Oakland County that calls. So again, we're asking for you to accept this donation today.
Thank you. We are happy to accept donations. Any questions or comments? Commissioner Cook?
This is Bob Hoffman. I have a question.
Hi, Commissioner Hoffman. Go ahead.
Thank you, Madam Chair. I'm just curious why we have to vote on receiving a gift like this. I mean, it seems like we should just be able to accept it.
I'm not positive, but I believe there's a requirement that after a certain level amount that the board has to accept it.
That's correct, Madam Chair. That's in the county policy and in statute, I believe, as well.
It's a certain dollar amount, or it's
I think it's $10,000.
Oh,
So yes, it's $10,000, or if there's ongoing costs. So obviously with an animal, we have ongoing costs. So even if it was below the $10,000 threshold, we'd still have to bring it to you for approval because we will have ongoing expenses for this dog.
Thank you. I'd like you to adopt me.
Thank you. Commissioner Kuhn?
Thank you.
Thank you, Madam Chair. Just a couple quick questions. Can you tell us a little bit about these 2 groups that are giving this, and also a little bit about the training that's provided to dogs and dog handlers? Thank you.
Yeah, the dogs themselves go through the Oakland Police Academy. They have a program there, and the trainers and the handlers go through it together. Commissioner, I looked up Crosshairs. They're a 501c3. They're related, I believe, to military and police that were created as a result of, I can't remember. It's been several weeks since I looked them up, but they are on the web. Crosshairs is, and they have a very good background. So I can tell you they're a 501c3.
Thank you very much, sir.
Yes, sir.
Thank you. Any questions regarding this item? All right, roll call, please.
Commissioner Cavell?
Yes.
Commissioner Gidgel had to leave. Commissioner Kuhn?
Yes.
Powell?
Yes.
Commissioner Powell, I didn't hear you.
Yes.
Okay, thank you. Commissioner Hoffman?
Yes.
McGillivray?
Yes.
Nelson?
Yes.
Lubes?
Yes.
I'm sure you have 7 yeas, 0 nays.
Thank you. Motion carries. Our next item is from the Sheriff's Office, Parks and Recreation, fiscal year 2021, off-road vehicle law enforcement grant acceptance. Need a motion? Motion from Commissioner McGilvery, support from Commissioner Nelson.
Thank you very much. This is a grant that we're asking you to accept for off-road vehicle patrols within the new county park called Holly Oaks that you're familiar with. It's an old gravel pit. The actually started this last year, was our first grant. This will allow us to do, if you recall, we did get a grant for a four-wheel drive quad runner for patrolling there. That's going to be a very, very popular park, as you all know. And so this will help us and the Parks and Recreation Commission make sure that we have proper patrols up there and everything is kept under control.
Thank you. Any questions regarding this item? Roll call, please.
On item number 7, Commissioners Kuhn,
Yes.
Powell, Powell, are you still there?
Yes, sorry. Yes.
Okay. Hoffman,
Yes.
McGilvray,
Yes.
Nelson,
Yes.
Cavell,
Yes.
Lubes.
Yes.
I'm sure you have 7 yeas, 0 nays.
All right, motion carries. Thank you.
Thank you. Thank you, Madam Chair. If I might just real quick, I had a nice conversation last night with Commissioner Cavell, and we're setting up some things to bring him in for tours, et cetera, which we'll do with the other new commissioners also. So it was a pleasure talking to you last night, sir. And I sent him some information about, little background information, so he had it prior to today's meeting. And then, Madam Chair, I believe your son is a detective sergeant in the state police, if I'm not mistaken. Well,
Yes.
He's famous because I read about him in MERS last night because he did the search warrant on the bomb threat at the Capitol. Which
Yeah.
you probably already know.
I don't know. My son abides by confidentiality a great deal, so I am the last to know. So thank you for telling me.
I'll send you the article. How's
I am
that?
today.
I'll send you the article.
Thank you.
All right. Thank you very much, commissioners.
Thank you for being here. And as a prior new commissioner, I want to let you know, Under Sheriff and everybody at the department was kind enough to give us a tour on, we enjoyed learning and seeing the actual buildings and meeting staff also. So great idea. Thank you.
Very good. Thank you very much.
Thank you. All right, our next item is from the 52nd First District Court in Novi, the 2021 Michigan Drug Court Grant Program Acceptance. They
Moved
have
by
a-
Hoffman.
Commissioner Nelson, support from Commissioner Powell. And it looks like we have Alexandra Black here. Oh, we have David Campbell. Who do we have here? Oh, we have both of you here. Thank you.
Yes, you have both of us. Thank you very much, commissioners. Good morning. I'm Alexandra Black. For the new commissioners who don't know me, I'm the court administrator at the 52nd District Court, the Novi location. I've been here for 25 years. I just hit my 25 years this year. And I'm joined today by David Campbell, who used to be my former partner when I was a probation officer here and is now our chief probation officer. And he's been with us for 23 years. So together we are requesting the acceptance of our ongoing grant. We've had a grant for a number of years through the State Court Administrative Office for our drug court program. Dave and I actually developed our just some history for the newer commissioners. I know, you can't come in knowing everything about us. And I had the pleasure of talking to Commissioner Cavell last night as well. He was making a lot of rounds on his phone calls yesterday, and it was great actually to connect with him. So this is a little repeat for you, Commissioner Cavell. So we started a sobriety court program here. It's an intensive form of probation, an alternative to incarceration, which sort of goes, we started many years ago trying to come up with some justice reforms. And we found as standard probation officers that people weren't necessarily as successful as we would like them to be. We had a lot of people repeating offenses, going to jail. So Dave Campbell and I started a sobriety court program for high-risk offenders. And they were primarily for high-risk drunk driving offenders, but we were throwing everybody in the program, no matter what type of substance abuse issue they had. And after 10 years, we did a study of our success rates and found that there were a number of people that were coming in the program that had opiate issues instead of primarily alcohol issues. So we started a program. I developed a program in 2012 after our 10-year study in 2011 to take those people out of the sobriety court program and treat them a little bit differently, have a little more intense scrutiny. I hate to use that word, but that's what it is. We tested them more often, and we found that they became more successful. As some of you may know, sadly, this last year was the highest death rate for overdoses in the United States. We had 81,000 people, and that was just up until May. So they went from May to May 2020, and we know that it's going to be a record number again. And, partially due to COVID and partially because the epidemic continues. So here at our court, we want to try to keep people out of jail and treat them instead of just throwing them away. And we've received these grant funds to fund the program. Primarily the funds are utilized for a probation officer who focuses just on this population. And she's been with us a couple of years. One of the things that I mentioned to Commissioner Cavell yesterday was that it's very difficult to have a brand new probation officer take this caseload because it's a pretty tricky population. And unfortunately, because of the disease, they can be more manipulative and cunning, and you have to really have some experience behind you. So she has graciously decided to stay in the grant funded position, which brings a little bit of uncertainty to her position here, and in her mind anyway, and stay on with the population. The problem is then, of course, we have to give that person raises, and so our grant request includes her salary and fringe benefits, and then we also had requested we requested $113,000, and we didn't get all 113 last year or this year because the funds that are given out on the grant are related to the amount of money coming in across the state from courts. And obviously due to COVID, they were not getting as they weren't getting as much funding from the courts. So they had less money to give out. So last year we got 87,000 of the 100 and some thousand that we requested, and we made it work, mostly because of COVID, because we had a lower cost. Those funds were utilized for her salary, fringe. Then we also do what we call Nighthawk, which is when the officer goes out with a deputy from the sheriff's department who is paid overtime and does some home visits. We call them visits, but it's to make sure that the person's living in a good environment, that they're free of alcohol and drugs in their home. They, aren't associating with people with warrants or felonies and whatnot. So, some of the funding last year was used for that. We use a lot of funding for interlock expenses because a lot of these people have to have an interlock device in their vehicle to get their driver's license back. And that can be pretty costly. So we use some of the funding for that, for drug testing, because a lot of them are unemployed and we require them to drug test, and that obviously costs money, for our conference fees, and for incentives for our people. So when they do well, they go in front of the judge monthly, some of them every other week, and we like to give them something to incentivize their continued success. So maybe it's free drug testing or little gifts that we give them. So all that money was utilized last year, and then this year it was reduced down to $78,000 because of the reduction in funds. So this year we are having to request a grant match, which we haven't had to do for years, but we're requesting a grant match from the county of $9,405 to make sure that we have enough money to cover her fringe and salaries, and that is all we're going to be able to cover. However, we have been told from the state court administrator's office that we can come back in March for the second quarter and request more funding, which we plan on doing. We plan on asking for about $24,500 more dollars to cover some of the costs for the participants and for the overtime. And we feel pretty confident that we'll be able to get that. And we also are going to ask, of course, for the money that we are asking for today as a grant match, so that hopefully we won't have to touch that money at all. I just want to note that, while our success rate is measured by completion of the program, and then we do some ongoing research into the people to see if they've recidivated and whatnot. And our program has, in the last 2 years, accomplished having a higher than average statewide average of success rate. And we're really proud of that. And we kind of liken that to, it's a very strict program. It's like a boot camp of probation, but the people that graduate are quite proud. And we've had commissioners attend our graduations before, and I publicly am inviting you all again. We always send out invitations, and you're always welcome to come. It's quite moving to see these people succeed. But when you think about 78,000 or 87,000 or 100,000, I don't know how you could put a price tag on helping these people move forward and succeed when a lot of opiate addicted individuals don't make it past a couple of years. And, when you talk about if these people had gone to jail, the amount of money that the jail would have spent, that we all would have contributed to, the healthcare expenses, the reduction in healthcare expenses, and just having successful people amongst us that are very proud of what they've done, and family members that don't have to mourn these people in the long run. So we're very, obviously, I'm going on and on, but I'm very proud of this program. So our request is that we not only are allowed to receive the grant money, but we also receive this grant match from the county.
Thank you. I do think the drug court is an important program. The specialty courts and mental health court, it's designed to help people. You're right. So thank you for your caring nature.
Thank you.
Any other questions or comments? Commissioner Kuhn?
Thank you very much, Madam Chair. And again, thank you for all you're doing over there at the court to help these individuals. Can you just give us a brief brief synopsis of what kind of measurement of outcomes you have and the numbers that go through your program?
Sure. So we have what we call a DCCMIS program through the state. So we have to input data on every single person. So we measure success through the clean drug tests to provide proof for their sobriety, their reported sobriety. The thing about drug addicted, the one thing we know is they don't show up if they're not clean. So we're able to, say, okay, if they're showing up and they're clean for the drug test and they're showing up to probation, they're doing pretty well. But we measure through those factors. We do recidivism studies. They can't be done all the time only because it's quite labor intensive to look at every single group member, but we do them sometimes every 2 years. The last one that we did that was the most comprehensive, when we did the 10-year study, we pulled records on, future criminal records on over 1,000 people at that point. And that's kind of one of the measures that we look at. Did they recidivate? Not just did they get a new driving license suspended or something that isn't related necessarily to using, but like, did they recidivate with a like crime or a drug or alcohol related crime? And so this last year we had, in 2019, we had 26 new admissions into the program, and there was a 72% success rate. Anybody who is kind of checked into opiate abuse knows that most opiate, it's like a 2 or 3% success survival rate once you start using. It's pretty low. So to get 72% of the people with an average, we keep an average number of sober days, And our average number of sober days from our graduates was 499. That's a lot of days for people who can't go not 1 minute. And then the state average for that is 343. So we surpassed that state average by quite a bit. And we do think that the drug testing and the intense scrutiny is, part of the reason for that.
Thank you for all you do, and thank you for your response.
Thank you.
Thank you. Any other questions or comments? Roll call, please.
Commissioners Powell,
Yes. I'm a yes.
Hoffman,
Yes.
McGilvray,
Yes.
Nelson,
Yes.
Cavell,
Yes.
Kuhn,
Yes.
Luce.
Yes.
Madam Chair, you have 7 yeas, 0 nays.
Motion carries. Thank you very much.
Thank you all very much.
Our next item is from Friend of the Court, fiscal year 2021, Access and Visitation Grant Acceptance. I have a motion from Commissioner Nelson, support from Commissioner, who would like to support?
Hoffman.
Thank you, Commissioner Hoffman. And we have Suzanne here to address this item. Welcome.
Thank you. This, I think, is my first virtual appearance in front of the Board of Commissioners. Thank you. And for the newer commissioners, I should introduce myself. I'm Suzanne Hellier, the Front of the Court Director for the county. And I'm here with a grant that we've had in place for 24 years. This is simply pass-through money that's available to support supervised parenting time. So in domestic relations cases, it's often, not often, it's rarely actually necessary to for the court to require parents to visit their kids under supervision. And this pot of money is it's federal money that comes through the State Court Administrative Office and is made available to us at the county level. And so we bid out the opportunity to provide this service. And this year, only Impact Consulting applied and they've been our provider for quite some time. So they're able to provide supervised parenting time for parents who otherwise, for free, for parents who are extremely low income. All the families on this that are served through this grant earn less than $10,000 a year. And the provider actually is very, their heart is very much in this program. We almost always run out of money by the end of the year, and they continue to provide the supervision. Sometimes we get extra at the end of the year, and then I come back for an amendment. But last year, that came so late in the game that the fiscal year was almost over. And I found out that they had been providing free services to the clients on this grant since August. So this year, the State Court Administrative Office has offered us $20,000, which is a little less than the amended amount we got last year. But again, there may be an opportunity. Some of the counties aren't really able to use their allocation at all. So often at the end of the fiscal year, additional money becomes available. And then they always call us because we always can use it. And yeah, so anyhow, I'm available for any questions if anybody would like to know more about it.
Thank you. Any questions? Commissioner Kuhn?
Thank you, Madam Chair. Again, nice seeing you, Suzanne. Although it's not in person, hopefully it will be soon. Can you give us a little bit of idea on the numbers, any outcomes, and the impact of COVID in the past year?
Yeah, when COVID first struck, Impact did shut down briefly, and then they were able to resume a month or two later using some social distancing but they're in masks. So there was that impact. They bill at a rate of $45 an hour on this grant until it's gone. So you can, and I get a report of the cases. So it's constantly changing the number of people being served because kids age out of our system. And then, the court no longer has jurisdiction over them. So it's a good number of hours that is what we measure actually. At any given quarter, there's about 40 families in the program. And then we report the case numbers up to the Supreme Court, and they reimburse based on that, the number of hours served.
Thank you very much. And again, this is a great program, and I appreciate all you're doing over there at Friend of the Court.
Thank you.
Thank you. Any other questions? Roll call, please.
Commissioners Hoffman,
Yes.
McGillivray,
Yes.
Nelson,
Yes.
Cavell,
Yes.
Kuhn,
Yes.
Powell,
Yes.
Luce,
Yes.
and a carry of 7 yeas, 0 nays.
Motion carries. Thank you for the information, Suzanne.
Thank you.
Our next item is from Public Services Community Corrections Division, Oakland County Community Corrections Interlocal Agreement with Oakland Community Health Network for Services. I have a motion from Commissioner Nelson, support by Commissioner Cavell, and we have Barb Hankey here to talk to us about this item.
Yes, thank you, Commissioners. Good afternoon and Happy New Year. This first agenda item is to approve the interlocal agreement that we have with Oakland Community Health Network. And basically what the agreement is through funds that we receive through our Department of Corrections grant, we split the cost of a full-time position that they call a criminal justice access liaison. And that person is embedded in our community corrections offices so that she can provide service to offenders and defendants that are in need of mental health and or substance abuse services through OCHN.
Thank you. And it's not a new contract for each of us.
That's correct. It has to be renewed every 3 years. And so this is the renewal.
Thank you. Comments or questions regarding this item? Commissioner Kuhn?
Again, thank you, Madam Chair. Good to see you, Barb. Can you tell us again if there's been any COVID impact, and if so, what is the impact of that?
Sure, and the COVID impact has been pretty significant for us, particularly in one of our programs, pretrial supervision. And mostly that's because when COVID hit and there was a lot of pressure for the jail, for defendants to be released from the jail. And the jail population went from about just over 1,200, I think they're down to under 800 now. Well, those defendants had to go somewhere. And many of the judges released them from jail, but put them on our supervision. And so since March, our pretrial supervision caseload has gone from 800 to over 1,800. So it's been significant. We've been pulling in resources from our other units to try to cover that. In addition, the other really big impact of the COVID is that we're seeing on the defendants. So many of the defendants are required to either drug test or be on electronic monitoring. And under the current rules, those costs are borne by the defendant. Well, unfortunately, many defendants lost their employment or they're unable to cover the costs, particularly of electronic monitoring, which can be as high as $390 a month. And so we have funds to pay for and help pay for electronic monitoring for those individuals who can't afford it on their own. Since March, from March to December, we've spent over $80,000 in electronic monitoring costs. And the reality is that we only have about $30,000 left to get us through the rest of this year. We are actively seeking funds to be able to continue that, but we're going to be in a very difficult position in a few months if we can't secure additional funding for those defendants.
Well, again, thank you for what you're doing. And how has this impacted your staffing levels? I know you're talking about having to reimburse people. How has the staffing been given the added caseload?
Like I said, in one area we are a little bit lower because the particular program called Step Forward caters to sentenced offenders. And of course, the sentencings have been much less during this COVID period. And so we were able to take a staff person from that unit and put it over into our pretrial supervision unit to help with the caseload. But that's basically what we've been doing is trying to move our existing resources around to cover everything. But it is becoming more and more difficult, even though my staff is all basically working from home, except for I think there's 4 or 5 of us here in the admin office. We are seeing, folks that are testing positive and are unable to work. And so it really has put a strain on our staffing.
Thank you for that update.
Thank you. Any other questions? Roll call, please.
On item number 10, Commissioners McGillivray. Commissioner McGillivray, are you still there?
Yes.
Okay. Nelson?
Yes.
Cavell?
Yes.
Kuhn?
Yes.
Powell?
Yes.
Hoffman?
Yes.
Loops?
Yes.
Madam Chair, you have 7 yeas, 0 nays.
Thank you. Motion carries. Our next item is Public Services Community Correction Division, Michigan Department of Corrections, Office of Community Corrections, Community Corrections Comprehensive Plan Grant Acceptance for fiscal year 2021. So I have a motion by Commissioner Nelson, support from Commissioner Cavell. And Barb Henke's here again to address this.
Great, thank you. This is our annual grant that we received from Michigan Department of Corrections. We have received this money every year since we first applied back in 1994. This year we applied for just over 1.8 million and they have granted us 1.9. So it's about 50,000 more than we requested. And basically that additional $50,000 has been earmarked for evaluation of our post-adjudication programs, the Step Forward program. As Ms. Black had indicated just earlier in her presentation, evaluation is key. And we get a lot of money from the Department of Corrections and from the state, and we want to make sure that we're using that money on programs that truly achieve what they're designed to achieve. And so we're hoping, again, to do an RFP to get an evaluation, a researcher to be able to look at our Step Forward program and ensure that we are in fact reducing recidivism.
Thank you. Any other questions? Seeing none, roll call, please.
Commissioners Nelson?
Yes.
Cavell?
Yes.
Kuhn?
Yes.
Powell?
We're not going in.
Powell?
Yes.
Hoffman?
Yes.
McGillivray?
Yes.
Loops?
Yes.
Madam Chair, you have 7 yeas, 0 nays.
All right, motion carries. Thank you.
Thank you.
Information. All right, the last item on our regular agenda is from Public Services Children's Village Division, fiscal year 2021 Child and Adult Care Food Program Grant Acceptance. So I have a motion from Commissioner Nelson, support from Commissioner Powell. Thank you. And we have Jody Overall here to speak to this.
Good afternoon. I'm Jody Overall, the manager for Children's Village, and this is one of 2 meal reimbursement programs that we receive annually. It's offered by the United States Department of Agriculture, and it's administered by the Michigan Department of Education. The funding period for the Child and Adult Care Food Program is October 1st of 2020 through September 30th of 2021. This meal reimbursement program is for kids who are residing in our shelter care program, and it provides reimbursement for all breakfast, lunches, and dinners 7 days a week. The reimbursement we received last year for the fiscal year was $40,664. The amount we receive year to year is dependent on the number of kids we have and the meals that we serve.
Thank you. This is a grant that's come before us year after year. Are there any comments or questions on this grant? You did a great job explaining it, Jody. Thank you.
Thank you very much.
Sorry. All right, roll call.
Commissioners Cavell,
Yes.
Boone,
Yes.
Powell,
Yes.
Hoffman,
Yes.
Gilray,
Yes.
Nelson,
Yes.
Loops.
Yes.
Madam Chair, you have 7 yeas, 0 nays.
All right, motion carries. Thank you. Is there any other business to come before this board? All right, seeing none, we will adjourn at 12:33. Thank you, everybody.